Hi everyone, my name is Jordan. I'm here with Mate. We are at St. Barnabas and we're going to do an interview with him to go over what we do at St. B's.
Yeah, right on. So St. Barnabas Episcopal Church is located in Eagle Rock in northeast Los Angeles. In early 2020, we started doing a food justice ministry here. This was right at the beginning of the pandemic. We started by handing out fresh produce to members of the congregation. We did this in partnership with Seeds of Hope, which is a food justice ministry of the Episcopal Diocese of Los Angeles, and Food Forward, which is a Southern California-based nonprofit. Together they provide millions of pounds of produce to hundreds of thousands of families across Los Angeles. Since the beginning in 2020, we've now grown to serving about 400 families here each week. We hand out about 4 tons of produce weekly. Anything that we can't hand out that's not for food, so if we compost on site, we use that in our community garden over here. And recently we also started developing a project to preserve any excess produce that is still edible through a dehydration process. We were able to acquire, partly through a grant, partly through donation, a couple of commercial dehydrators. So we're working on creating nutritious, shelf-stable alternatives to the fresh produce that we hand out.
What do you think are your obstacles that you currently face and the biggest problem that...
Yeah, definitely. So one thing that your group has helped us with tremendously is interfacing with the community. So we are a pretty grassroots operation. Most people that come here find out about us through word of mouth, and we definitely ran into some challenges in communicating with the people we serve on a consistent basis. Your team has been wonderful in brainstorming and providing some different options, from the idea of establishing some like bulletin board or something like that, and also just creating these deliverables that we can hand out on a weekly basis and providing people with just more information about how to use the stuff that they get on a weekly basis, since it varies, as well as what the benefits are. So building knowledge alongside the access as well.
Okay, so just to kind of reiterate, communication seems to be the biggest issue, and getting the word out to the people, especially with the patient population that we have here. Could you explain a little bit more about the community that we serve?
Yeah, definitely. So the people we serve here are predominantly Hispanic and Filipino, mostly elderly. Most who come here are either somewhere in the vicinity of the federal poverty line, so at-need populations, definitely. I mean, in your time here, you've seen that we have a reliable base of regular faces that show up here. So most families that take advantage of this service are dependent on it. One thing I would like to highlight is that most people that come here are local to the area. We have some people driving in from various distances. We work with community partners that take our produce as far as Palmdale and Lancaster, but for the most part, we're very much localized in northeast LA area.
Okay, awesome. Thank you so much. I think that's all the questions we have for today.
Right.
This is St. Barnabas, and we serve the community through food distribution. Thank you.
So what's going on?
So we just finished setting up our tabling for today. Today's topics are knowing your numbers, so like your A1C, all of that, and life's essential 8, which is here, and they're just heart-healthy tips. Basically overall tips to improve your lifestyle relating to your to making your heart healthy. We have stress balls to offer after talking to people, as well as a fortune teller that allows you to know a tip that could help you with a healthier lifestyle.
Cool.
My name is Meg. I'm a registered nurse here at Healthcare in Action. So we are a street medicine team. That's like the quick and easy way to talk about us. We provide primary care services, mental health, addiction medicine to people who are experiencing homelessness. So maybe they live on the street, maybe they live in a shelter, maybe they live in their car. So anybody who's kind of at that phase, we're able to offer services to, and then we follow them holistically if they need mental health services, whatever they need, through getting housed. That's the goal of our program. We have housing navigators that work with us. So it's really about whole person care, and our goal is to get someone housed, and usually within about 6 months of having them housed, we will transition them to a community-based clinic or primary care provider. But that's kind of what we do.
And what would you say your role as an RN is? Like, what would you do in your day-to-day?
Yeah, it's very versatile. It changes every day, which is why I like it. I'm able to do patient intakes on my own. So sometimes the doctor's not there, but we have somebody who's interested in services. So I can see them. I can do an initial assessment, normal things like taking their vitals, doing health histories, seeing, especially in the work that we do, I want to know everything about my patient, where they come from, kind of what's brought them to the place that they're in. So, and then from there, I can do more, kind of clinical things. If somebody needs an A1C drawn, or we need to check blood glucose, maybe we need to get them to labs, things like that. But I also do a lot of kind of more maybe administrative things. If a client has issues with insurance, I can help them get that figured out. I work with case managers a lot. I always want to make sure that, it's hard to take care of my patient's physical health if their mental health's not taken care of, or they don't have enough clothing, or they're not getting adequate food, things like that. So I feel like as nurses, we fill in a lot of gaps. Wherever there's need, we basically step in and fill that role. So I feel like that's what I do a lot. Some of it's clinical, some of it's administrative, and everything in between.
Okay,
last question. What would you say your patient population is like?
Wow, it's a great question. Just thinking of my specific patients, definitely all ages. I would say most of them are 40 years old and above. There are definitely a lot of young people who experience homelessness, but I don't have many of them as my patients. So I would say most of them 40 years old and above. All races, ethnicities. I don't see like much of a I don't think there's like a common ethnic or racial background to my patients. A lot of men. I would say like quite a few. I have more male patients than I have female patients. And it's interesting. I would actually like to dive more into the demographics of my patients, but I would say, yeah, middle-aged, older adults, and a lot of like very kind of male-centric.
And what would you say is the spa that you most serve?
Most often, we're probably in Spa 4. So we do a lot of like East LA, but also maybe a little bit down to Spa 6, because sometimes we'll go to like the Crenshaw area, kind of near USC. So I would say my team is between 4 and 6.
Thank you so much.
Of course.